Now, if you could take 5 minutes, share your perspectives with us, particularly in the areas of community-based work and health equity,
Sure.
That would be great.
Be happy to. And thank you so much for the opportunity to speak with you today. One of the advantages of going last and after lunch, and we've had the morning, is that a lot of the issues have been addressed. And so I want to focus my brief remarks on the issues of equity and physical activity, and why are some of the things that I see when I'm out in communities trying to help them implement programs, and what are some of the barriers that come up, and what are some of the issues that I hear from community members and from adolescents. And one of the things, and I apologize up front for if I do a lot of acronyms, because I have 5 minutes, so I might just zip through some things. One of the things is like to remember that equality is not equal to equity. I mean, it's not the same thing. So if I think, I've been doing this for about 20-something years now, and the big push at first was to get a park in every neighborhood, or to get this in every neighborhood. And I think that's, while it's important, it's not sufficient, because if you build it, it doesn't mean that they're going to come. There has to be, people have to feel invited, feel welcome, and to find something that they want to do at these, when you build this infrastructure. And so I think it's more about the equity piece is more about finding out what people want to do to be active, what their interests are, and building around that, and involving them in the process. And so many folks today spoke about that, so I don't want to belabor that. But also, there's a model that we think about. It's called the Progress Plus model. I think it's out of Denmark and or Germany. And they talk about, when you are doing a strategy, in order for it to be equitable, you have to look at, P for place of residence, race, ethnicity, and culture, occupation, gender, sex, religion, education, SES, social capital, and then the plus is age and disability. So to think about those factors in the design of programs and the implementation of programs, because inevitably those are the things that get left out. One of those aspects, and in order to be equitable, you have to think about all of those. Unfortunately, there have been many programs in the past 10 or 15 years that have begun to address issues, of equity. Things like our program, CANFIT, Active Living by Design, the Healthy Eating and Active Communities program, Heal Zones that Kaiser's done, the Kellogg Initiative, the Food and Fitness. All of them have begun to put equity higher up in thought, in the planning and the development. And also some interesting things are happening in Denmark, where they are working on redesigning the whole school system so that it's more of an active learning environment. So I think that those are very exciting thoughts to try to remember, to make it so that just in terms of doing the learning, that you're active in doing all learning. But I had 10 points, and I don't have time. I'll have time for 10 points, so I think I'll do 5 or 6. But so in terms of implementation issues, one is to remember that the goal is lifelong physical activity. You want people from beginning to end to think of activity as fun, enjoyable, something that they want to do. And unfortunately, a lot of the work that's been going on so far has, people who tend to be active are the ones who kind of go for it. And so, especially when you get into the age group that we work with, which is 10 and up, It's the out-of-school time is very important. The community time is very important. So thinking about things that people want to do their whole lives, not just in a school setting or learning a skill that for a team sport. So trying to build up programs that work on things like dance is very popular, and from like line dancing and salsa dancing and community events that feature dancing, things like Tai Chi and body awareness and yoga, where people are learning skills and how to work with their bodies so they can be active for a longer span of time. I think it's very important, and which brings up the whole issue of pain and the result of injury and why people stop being active. And it's often because of pain and because of things that, as a school athlete, they overwork a shoulder, so then they can't work that anymore, so they can't do the activity they learned to do, so they have to do something else. So I think that it would behoove you to think about ways to start to include injury prevention in your work, and to give people from a young age skills and how to learn about their bodies and body mechanics, so that they are doing activity correctly, because that will serve them over the long haul. People have mentioned violence, and yes, it's still a factor and still an issue. There are programs like one of the HEAL zones in Sacramento, Health Education Council has a Walk with Friends program where they have taken over a park that used to be in fact, when they were doing the audit for the park to try to come up with a plan, there was a gang out shooting during the audit. So since that time, the neighborhood has taken over that park and doing a walking group with our residents, where just the idea of social support around activity. So things like our walking groups. I think someone's, I spoke earlier about our meetings, our walking, our meetings, a meeting of friends for walks, things that build a cultural norm around, around activity. Speaking about the level of community engagement and leadership development, I think that's been spoken about before, but there really is a need for the training and TA in the field, because we come up with all these policies and things that people should do, but they don't know how to implement them. I was asked once to come into a hospital-based system. They got an enormous grant to do work around obesity prevention, and they had a wonderful program. They couldn't get any of the residents to come to it because it was geared as a weight loss program or obesity prevention program. And I think that's one of the main points I want to make. It's just that it's how we frame this. That I think that we have to broaden physical activity so that it's not just a weight loss issue, because so often people come to it and they begin to be active, they don't lose weight, and they say, well, it's not working. And so they stop. And so you have to broaden to think about all of the other benefits of activity, the social support, stress, longevity, being able to get up and down easily. I mean, just all the different things. Because for a lot of people, the weight loss is not going to be the hook. It's going to be the other aspects. So I want to end my remarks by just saying that the questions to ask about when you are implementing or are designing a program are things like, who benefits, who pays, who's harmed, who leads it, who decides what's happening in it, who speaks up for it, and who speaks at the meetings and events, and who funds it and how much is funded. So I thank you for the time, and I hope that next year is going to be a whole day spent on equity and not just a 5-minute remark. So thank you.
Great, thank you.